Good evening, everybody. We welcome you to our Thursday night. Let's talk about it. Thank you so much for tuning in tonight. We have a great topic and a great guest tonight. We are delighted to have with us Dr. Rachel Sherman, and I'm going to ask her to come and introduce herself, and then we're going to get right into this.
All right. Good evening, everyone. So, as Bishop said, my name is Rachel Sherman. I recently obtained my doctorate degree, which I'm really excited about. Still getting used to people calling me Dr. Sherman, but super excited to really just bring healthcare to the community. We're still very much so in this pandemic. Lots of long nights and long days. Really excited that there is a vaccination, and I wanted to help to clear up a lot of misinformation about the vaccination. Certainly, we know America has not had the brightest history with minorities when it comes to medicine. So that's why I really felt it was important to try to spread this information. And I really thank Bishop for giving me the opportunity to do so. For those of you that don't know, I practice in Maryland, Washington, D.C., and Northern Virginia, primary care and palliative care, both in the outpatient setting and in the hospital. And certainly just looking forward to giving good information tonight.
Okay, great. Now, Dr. Sherman, you've had a few exciting things to happen to you since the last time you came on to share with us about when COVID first came out. And you were recently given an award for the Rosa Parks Award for Excellence in the Community.
Yes. So Prince George's County County Council, Councilman Sidney Harrison, nominated me and awarded me with the Rosa Parks Award for Excellence in Community Activism. So, in addition to being a medical provider, I'm really active in the community, whether it's going to schools, talking to children, educating local churches or local police departments, or just organizations, as well as fighting for social justice. So the organization I've co-founded, we get information about a lot of things in the community that just don't seem right. We feel like people aren't being treated equally, and we go out and we address it. So this summer, while obtaining my doctorate, I also led a daily protest against a local restaurant that has a long-standing history of racial behaviors. That restaurant is closed now. They may potentially open back up, but we've done a lot of work to seek equity in our community.
Excellent. I've been keeping up with you and all the great work that you've been doing. And so we applaud you tonight for your excellent work in the community and what you're doing in the medical field as well. So, Dr. Sherman, if you could do one thing for me before we get into the questions, could you put your Cash App in the chat box for us tonight?
Sure.
And if you're watching on Facebook Live, we welcome you tonight, and we ask that you would do one thing for us, two things. First, share it. And then if you have any questions, type your question in and we will do our best to get to it. So with that being said now, Dr. Sherman, I feel like she's one of us. And we want to do as much as we can to support our Black entrepreneurs. And she has worked hard, and she's gone to school, she studied, and she has acquired the knowledge to be able to come and bless us and help us tonight with some of these questions that we sometimes struggling with to get answers to. And so she's here tonight, and we want to be a blessing to her tonight. So those of you who find it in your heart to sow a seed into her Cash App, please do so tonight. Okay, let's get started. Dr. Sherman, you were sent a list of questions. Now, those of you who did not get an opportunity to send questions in to Dr. Sherman, if you do have a question, put it in the chat box. We will read it and we will allow her to address it. So those questions that you have already received. You can bring answers to that, but you can start this any way that you want to, and then you can move into answering the questions. So the floor is yours.
Okay, thank you. So I'll start with saying that we are still very much in the midst of a pandemic. I think, Bishop, you see me leaving the hospital 11, 12 at night, while working, a full-time job during the day. I'm out seeing patients in the community. Then I go to the hospital at night because people are still really sick. People are still really separated from their families. I know that we've been in this for a very long time. We miss socialization. But we still have to do what's responsible for right now so that we can get back to somewhat of a normal way of living. And which is why I'm really excited about the vaccination. I will tell you, I have received the vaccination. I've taken both doses. My mom has taken both doses. And just about most of the colleagues that I work with at the hospital and out in the community, they've had their COVID vaccinations. We were the first group of people to get vaccinated. And I'll tell you why. Healthcare workers have unselfishly, continuously run into the fire. We are walking into the hospitals, we're staring COVID in the face every day. And we then become a nidus, or like this walking ball or potential for infection, because we deal with it every day. So it was only the right thing to do and the responsible thing to do to vaccinate healthcare workers. So I'm going to get into the questions. There were a good amount of questions that came in. It seemed like a lot of people had questions about allergies and who should take the vaccination versus who shouldn't. So I grouped those questions together and came up with a targeted response to include all of those questions. So we'll start off with question 1. I have both food and medication allergies. Should I exempt myself from taking the vaccine? So the CDC is recommending that people with a history of severe allergic reactions that are not related to vaccines or injectable medications, such as food, pets, venom, environmental, or latex allergies, get vaccinated. People with a history of allergies to oral medications or pills and a family history of severe allergy or allergic reactions should also get vaccinated. Who should not get the COVID vaccine? And this is important because we talk about severe allergies, but the CDC is very specific about who should not get the vaccination. So although extremely rare, there have been reports of severe reactions to the COVID-19 vaccine. There's a lot of good information out here. There's a lot of bad information. So when we see on Facebook and social media that so-and-so had the vaccination, and they died a day or a week later, we can't always contribute that to COVID. We have to keep in mind that people have been isolated. They're not in the greatest health. They haven't been able to see their doctors in almost a year. So there are other things that contribute to life events and not just the vaccine. Recommendations from the CDC are, if you have or have had a severe allergic reaction to any ingredient in the mRNA COVID-19 vaccine, you should not get either of the currently available vaccinations. So that's either Moderna or the Pfizer vaccine. If you've had a severe allergic reaction after getting the first dose of the COVID vaccine, the CDC recommends that you do not get the second dose. And severe reactions are shortness of breath, swelling of the tongue or lips, breaking out in hives if you require to get an epi injection because of a reaction. If you are allergic to a substance called polysorbate, and most people who are allergic to this have had allergy testing. This is not something that a lot of people just advertently know that they're allergic to. But if you're allergic to polysorbate, or any ingredient that's listed in the COVID vaccine or closely related to PEG, which is in the vaccine, it is recommended that you not take the vaccination. And this is something you should consult with your physician about, or your nurse practitioner, so they can really talk about what you're allergic to and your potential for having a severe reaction. If you have had an immediate reaction, even if it was not severe, to any vaccination for any other disease, so not just COVID, you want to talk to your medical provider before you get the vaccination. It's important because we need to weigh the risk and the benefits, talk about what your reaction was. A lot of people get the flu shot and then they believe that they've gotten the flu as a result of it. That's not necessarily the case, but we want to talk about what's severe, what's not severe. So these are important things to know. The CDC says that pregnant women can get the vaccination. There is not a lot of information about vaccinating children. That is information that they're collecting currently, but pregnant women can get the vaccination because they're considered high risk for COVID. Some of the safeguards, and I can tell you that the sites that are offering the COVID vaccination take this very serious. So if you have no history of having any type of allergic reaction to injectable medications, you will be required to stay on site for 15 minutes after getting the vaccination. If you have had some type of reaction to an injectable medication, they're going to keep you on site for 30 minutes. All of these sites that are providing vaccinations have emergency medical equipment there in the rare occasion that they have to use it. And this is all mandated by the CDC. In addition to that, for anyone who gets the COVID vaccination, the CDC has an app that they want you to download to track your symptoms after you get the vaccination. And most of the symptoms are fairly mild if you have them at all. But this app is called V. V is in victory, safe. When you get vaccinated, the site will give you a paper with how to get into the app. But this is the best way that we can, as scientists and medical providers, collect information about what's happening post-vaccination outside of all of the clinical trials that have already been done. So question number 3. Does the vaccination protect individuals from the mutated strain of COVID-19? So we're still learning about this and we're still observing, and our knowledge is growing every day. It's frustrating as a medical provider to say we don't know, but when COVID comes into play, we truly don't know. There's so much that we're learning every day. But at this point in time, most scientists and researchers believe that the vaccines that we currently have available will provide some protection against these variant strains. And that's because the vaccinations elicit a fairly broad immune response. So there are a host of antibodies that you'll develop as a result of the vaccination, which they believe will protect you from these new variant strains of COVID. Going on to question 4, how long?
Before you get to question 4,
Sure.
can you do something for us? Can you talk about some of the myths out here first before you get to question 4?
Sure.
Because there's a lot out here. We see them in social media. They're flying everywhere. So if you could give us that piece and then we can get back to the questions.
Sure. So some of the myths that I've received or questions I've received that, I've had people inquire about how the vaccine is developed. I can tell you that the 2 vaccinations that are currently approved in the United States did not do testing on any aborted embryos. I know that for a lot of people, that is a big point of contention. That's not the case with Moderna or Pfizer and many of the other vaccination manufacturers. Some of the other myths are if you get the COVID vaccine, it will cause you to develop COVID. The virus is not actually contained within the injection, so it's not an attenuated virus, so it won't cause you to develop COVID. There's a lot of information going around about people developing Bell's palsy. So that's paralysis of one side of the face. And Bell's palsy is highly associated with viral infections, dental work, stress, shingles. So, on the rare occasion, it could potentially cause a side effect. But again, that's rare. What we really want people to understand is that vaccinations truly work. If you can think about, and most people may not remember this, but when polio was going around, they developed a vaccine against it, and now you rarely see it, if you see it at all. So vaccines do work. And one of the questions, we'll get into this, but a lot of people are concerned because they're like, this vaccination just came out of nowhere. It was developed too quickly. And even I thought that myself until I actually went in and looked at the data and looked at how this vaccine was developed. We'll actually find that they had already been in the works to develop a vaccination against coronaviruses, which is what family of viruses COVID belongs to. So most of the groundwork was already done. And then we had this pandemic hit, and we already had the groundwork to begin to go right into clinical trials with COVID vaccine. So it's important to know that. So those are some of the more prevalent myths that we see. And I've had a couple people ask me, and there's sometimes conspiracy theorists, and there's people have this thought process because, again, America has had a very dark history with the medical treatment of minorities and women, especially Blacks. You look at the Tuskegee Airmen situation. So a lot of people are like, they're drawing your vaccination up from a different vial. And I'm like, no, my vaccination was drawn from the same vial that my two colleagues was drawn from right in front of me. They're Caucasian. I'm, African American. So no, I wasn't given a different vaccine. So I want to clear that up as well, because that's a big myth. And I can understand why people are very apprehensive and suspicious.
Okay, excellent. All right. Now, based on what she has said, now, if you have any other questions about the myths, put them in the chat box and we'll get back to them. But I'll let you continue answering the rest of the questions that you have. And then those of you who are on Facebook, if you've just come in, you have a question, write it in, they'll get it to me. And please share this Facebook Live to your page tonight, because we want to get the knowledge out to as many as possible. I would rather have someone that is well qualified to answer our questions than for us to be chasing down these rabbit holes with these conspiracy theories and stuff, information just coming from everywhere.
Yeah, I always tell people, vet the information that you're looking at. And for me, that's going to be medical institutions that I trust. If you go to a website and the first thing you see is an advertisement for a medication or a medical device, that's not a website I'm inclined to trust. And that's one of the ways I vet and make sure I'm getting good information. So question 4, how long does the vaccine protect individuals with antibodies from the virus? So current evidence suggests that people who have antibodies as a result of having COVID, those antibodies last somewhere around 90 days. Does that mean that you cannot get reinfected? No, because we do occasionally see cases of reinfection or prolonged infection. It's very uncommon or infrequent, but it does happen. So, the CDC says that people who have had COVID before should get vaccinated. They should wait 90 days after initially testing positive. We don't know how long immunity will last after vaccination. And that's because we're still collecting data. So we know that giving you the vaccination will it will invoke an immune response. So you'll develop antibodies. How long those antibodies will last, we're not sure. I've heard a couple things coming from a couple different credible sources that, they were initially thinking this would be an annual vaccine like the flu. And then we're thinking, oh, it'll be every 3 to 5 years, kind of like our pneumonia and our tetanus. But this is just to be determined because we're still developing more information every day. So experts are working very hard. We're collecting data from so many different inputs, information from the community level, from schools and from hospitals. So it's a lot of information to analyze.
Can you see the questions that's coming in the chat box?
I can.
Okay. And you can take them in whatever order that you like.
Okay. So somebody asked, why is there so much misinformation? And that's because we live in an era of social media where everybody gets to have an opinion. And whether their opinion is factual or not, everybody has this platform to then put their opinion out. A lot of times people don't necessarily have the credentials to comment on medical issues. And that was, not to be on the political side, but that was something that was really disturbing about the previous administration, is that we had individuals like the president, who was not a medical provider, commenting on medical things and throwing out the names of medications like hydroxychloroquine, but he really wasn't qualified to do so. And that's pretty dangerous when you're taking medical advice from people who are not specially trained. You know, myself, I have over 10 years of education. Physicians have way more years of education, even, than myself. This is what we train for. Not only do we train, we constantly update. So misinformation is coming down the pike because opinions are different, and you have people who aren't qualified to make these decisions or comments who are. And that's why I say you really have to trust and know that you're getting information from credible sources. I wouldn't go to my heart doctor if I needed a brain surgery. I'd go to a brain surgeon. So that you got to make sure you're getting information from someone who's qualified to speak on it.
Can you give us a few names of some qualified places, sites that we can go to if there are like updates that we know that is credible?
Absolutely. So Harvard University has a really good website. Yale has a really good website. Johns Hopkins has a really good website. And in fact, Johns Hopkins was a leader in this. They had one of the most robust COVID monitoring surveillance systems when COVID hit. This is where experts were going to see where the numbers were coming up and to get information. So Johns Hopkins is excellent. The CDC is good. The World Health Organization, the previous administration removed us from the World Health Organization, but this is really where we get information about health around the world. But the information is only as good as what countries report. So those are kind of your big, broad sites. University of Maryland is a good one out here in Maryland. You have GW, places that are doing research and actively involved in gaining more knowledge. For you locally, you want to look to like your state and county Department of Health, or because they're getting information directly fed down to them from the state level as well as from the national level. So your state Department of Health would be, or your county Department of Health would be a place where you could go to get good information about what's happening locally, especially when it comes to vaccination availability. So I'm going to hop back on to question number 5. How could this vaccine be developed and tested so quickly? I will say that this is probably the number one concern for most people when it comes to taking this vaccination. And it was even a concern of mine until I educated myself to really see how this vaccination was developed and the fact that it was being developed even before we hit into this pandemic. So the biggest misconception surrounding COVID or the COVID vaccine is that the work on the vaccine started when the pandemic began, and that's not the case. Coronaviruses have been around for a very long time. And we've had COVID or coronavirus outbreaks, similar to with SARS and MERS, right? So we've had information about the general makeup of coronaviruses. So with that being said, there was already a foundation for researchers to start a vaccine and isolate certain spectrums within the COVID virus. So we immediately went into clinical trial. Whereas with other vaccines, it takes a while planning, identifying what you're trying to target. That wasn't the case here. They immediately went into clinical trial. And this meant that experts really weren't starting completely from scratch. And that's why we were able to develop the COVID vaccine as quickly as we were, because most of the work had already been done. mRNA, and that's the type of vaccine. Those types of vaccines are not new. The companies Pfizer and Moderna, they have been developing and working on these types of vaccines for many years, including conducting successful clinical trials on humans. And it's important to know that medicine is science. Medicine is not concrete, because things change and bodies are different. Humans are built and respond differently. So we are constantly learning and changing things in medicine based on what we know. Let me see, I see some questions in the chat box. Earlier, you mentioned how there was already testing for the vaccine prior to the pandemic breakout. This was because, so the reason that they were already testing a vaccination was because we had had previous coronavirus outbreaks. So SARS and MERS, we've already had viral outbreaks in that same family. So COVID-19 is a coronavirus, which is a big umbrella. So that's why they were already developing or creating and testing vaccines for this particular family of viruses. Another question is, what if the person is asymptomatic and was not aware that he or she had the virus? What do people do to make sure that they do not have antibodies prior to taking the vaccine? So that's a good question. 58% of people who have COVID are asymptomatic, and that's very scary. And there's no real way to determine how long you've had your antibodies. We're not recommending that people get antibody testing before taking the coronavirus. It's just the recommendation of the CDC to wait 90 days because you already have some type of antibody if you were exposed or had COVID. So it won't harm you, it won't make a big difference in your response. The question is, can you discuss the RNA technology in this treatment? So, well, RNA and viruses in general, the way that viruses live and thrive in the body is they mutate. They get into the viral cells of the body and they duplicate and duplicate. They have a way of hiding out in the body's own DNA. So with COVID, one of the mainstay treatments was an antiviral that had a way to interrupt the viral splitting. And if they interrupted it and stopped it from duplicating, they could either cut down on the duration or cut down on the severity of the illness. There's a lot of information to be discovered about how mRNA is being used, but it's essentially a manuscript or a copy of what we're dealing with, not the actual virus. And we're using that to attack spikes on the coronavirus cell itself. So if you ever see a picture of coronavirus, it's always this little ball with little spikes sticking out of it. And so they're developing vaccines to actually attack the spikes on the virus itself. So that's how they're using this technology to vaccinate and develop an immune response against the coronavirus. So I'm gonna, I'll hop back into some of the questions and then I'll come back to the chat box. So question 6, is the vaccine more effective if someone had the virus and got over it? Currently, there's no evidence to suggest that the COVID-19 vaccination provides superior immunity in patients who previously had COVID. There's a lot of information to be collected and known, but that is not one of the things that evidence is suggesting right now. Question 8, what are the side effects and have they considered the long-term side effects of the COVID vaccine? So scientists and medical providers are actively working to examine the long-term effects, if any, of the COVID vaccination. Keep in mind, this is a new virus, this is a new vaccination, so we're really going to rely on the collection of data, which is why it's important that people report using apps like vSafe so that we can collect as much raw data as we can. Common side effects of the COVID-19 vaccination may feel flu-like. Fever, fatigue, body aches, soreness at the injection site, and some people even, they have trouble carrying out their next couple of days of activity. So I've had some people who've had to stay home for a day or two because they just felt so tired or achy after getting the vaccination. That's not a severe reaction. That's something that we actually come to expect, more so with the second vaccination. With most COVID vaccines, the ones that are available in the US, you will require a second shot in order to maximize or achieve efficacy. So getting the second shot is important, even if you had mild or moderate side effects with the first shot. And this is unless your provider tells you not to get the second shot, and that's usually if you have a severe reaction. It takes time, even after getting the second shot, it takes time. It may take a couple weeks for your body to fully build the immune response. And this is why it's important that you continue to adhere to social distancing, wearing your mask, washing your hands, staying home if you're sick. Question 9.
Yeah,
And
when
this
you,
was
before you get to question 9, those of you who have just come in on Facebook, thank you so much for coming in. Would you please share this to your page as you come in?
great. Thank you. So question 9, once you get COVID, this is a 3-part question. Can you get it again? Yes, there have been cases of reinfection, although rare, there have been cases of reinfection after 90 days. And again, that's why it's important that we continue to adhere to the safety regulations, because people around us are still catching COVID. So we have to not only protect ourselves, but until we have the bulk of our nation and our environment protected from COVID, there's still the possibility that it can spread. So we're looking to really achieve something called herd immunity, where a majority of the population have some immunity, and then we'll see our COVID numbers dramatically taper off. Do you still have to get vaccinated if you've had COVID-19? Yes, CDC is recommending that persons who've had COVID-19 get vaccinated because they can benefit from it. They just have to wait at least 90 days from initially testing positive. How long does the virus remain in your system? This is a very good question. I have some patients who have tested positive for COVID week after week after week. And I've had some people who have tested positive for COVID, and then, they do their 10, 14-day quarantine, and then they test negative. So COVID can remain in the body from days to weeks, and it varies based on each individual. It also varies based on how sick you are. So I have some patients in the hospital been on ventilators 30, 45 days, and they continually test positive for COVID. Question 11, if you get the vaccine, can you still spread the virus to others? So you can only spread the virus if you're infected with COVID-19. The purpose of the vaccine is to provide you immunity and or an enhanced immune response if you come in contact with the virus. So getting the COVID-19 vaccine will not cause you to contract COVID-19. It's meant to protect you, to give you some level of immunity. So it's important to know you can only spread the virus if you have it. And that's why we say do your due diligence, hand washing, safe distances, using your mask until we see that our COVID numbers have tapered off. Question 12, this is also a very good question. What is the difference between the 2 doses, and why are people having issues with the second dose? So Moderna and Pfizer, they're the 2 vaccines that are available in the US right now. One of them is a 0.3 ml injection. The other is a 0.5 ml injection. There's no difference between the first and the second dose. It's just you have a stronger reaction to the second dose because the body's reacting to the development of this immune response. So we give you the initial dose, the body says hello and makes its meet and greet, and then you get the second dose and the body's like, you don't belong here, or you've overstayed your welcome, and your response is a little stronger the second time for some people. And this is information that they knew when they did their phase 3 clinical trials, and that we're continuing to see. I've had some colleagues that had to stay home for a day or 2 after the second shot. I didn't have any side effects with either shot, so it varies from person to person. Question 13, and it looks like we only have 3 more questions left, and then I'll get into the chat box. What is different about the new strain? So I want to preference this with, it is the common nature of viruses to mutate. That's how they stay alive. So it's not surprising that the COVID virus is mutating and changing. This is just common nature for viruses to do this. They don't behave like bacteria, so viruses do change in nature in order to stay alive. Information about the characteristics of these new strains of COVID are rapidly evolving as we learn more information. We're still learning about COVID-19, but we're working hard to understand more and more about these new strains. What we know right now, or what research is suggesting, is that these new variants are no more deadly than COVID-19. However, they're noted to be more contagious. And that means that they spread from person to person a lot easier. But it doesn't mean that you're expected to be more ill, or, we'll see a higher level of morbidity or mortality because of it. Question 14. If you get COVID, what can you do to help recover? Are there any natural remedies or supplements that can help? So as a medical provider, I'm supposed to say, this is not medical advice. Always consult with your medical professional if you think that you're ill. So I'll say that this question is highly individualized. Everybody will respond different. If you think you have COVID-19, again, you want to reach out or make a connection with your medical provider. So you've already developed that relationship, and they can give you the latest and updated information for treatment. In general, for any type of illness, things that people can do to help recover, especially from viral infections: maintaining adequate hydration, balancing rest and healthy activity. So when you're ill, the first thing you want to do, you want to lay down, you don't want to get out of bed. Some activity is healthy. You've got to get up, you've got to move, you've got to deep breathe. Deep breathing, so I have that one here: opening up the lungs, meditation, staying in a positive mindset. I can't tell you how many times people get really down and sad when they hear that they have COVID, and it's almost like they just the virus is just going to take my life away. And that's not the case. You have to have a good mindset, keep a positive mindset, develop a good social circle, a prayer circle, because your mindset has a lot to do with how you recover from anything. Some of the other things are maintaining good nutrition. So if you're sick, the last thing you want to do is just eat ice cream and things that are going to raise your sugar, and not really give your body the nutrients and energy it needs to recover. And one of the most important things that you can do is maintain good health before you get sick. So we know that people who have health conditions like diabetes, COPD, hypertension, these are people that really suffer the most with COVID. So it's important that we work on being healthy before we get sick. And then, the most important, I see this a lot with my patients that come into the hospital: they stay home and they wait until their symptoms get so severe that they can't take it. In Prince George's County, we have a very large Hispanic population, some of which are not documented, and they are afraid to come to the hospital. And I'll say this for any of my populations that are watching: if you have COVID and you are severely ill, I don't care what your immigration status is. You come into the hospital and you need my help, I'm going to help you. Papers, our primary focus is to get you well. So please do not sit at home in fear that you're going to be persecuted for coming to get help. Do not wait until you cannot breathe to come in and get help, because sometimes it's too late. So I'd say that you're sick and it's to the point where you're really short of breath, you can't keep down food and fluids, you can't get your fever to go down with medications, it's time to come into the hospital. And current research suggests, so this is research, and vitamins are not highly studied in traditional medicine like they should be, but vitamin C, zinc, and vitamin D are some holistic approaches. I do have some patients in the hospital that I'm prescribing vitamin C, zinc, and vitamin D to, in addition to other modalities to treat COVID. And lastly, can you get the shot if you're still experiencing issues from COVID? So if you're experiencing significant and noticeable side effects from COVID 90 days after testing positive, I recommend that you speak with your medical provider. COVID can have lasting and lingering effects. We're seeing effects on the kidneys. Now we're seeing children coming in with inflammatory rashes all over the body. So if you're still having significant side effects after 90 days, talk with your medical provider. We do know that side effects can last from weeks to months. I have some patients that are 6 months out and they're still recovering, but these are conversations you really need to engage with your medical provider about. based on your clinical presentation, your medical provider will say, yeah, I recommend you get the vaccination, or I think we should wait. So that's a highly individualized question, but a good one. So those are all the pre-questions I had. And then I'm going to go into the chat box. So let's go up some. So there's a question, do you know of monoclonal antibody infusion I had to get due to me being high risk health? My only side effect was dizziness and itching. I was tested positive for COVID. My sign was no smell, no taste, which is common. I don't have any fever, body aches, but get better each day. So one of the treatments that we've been doing, and this is why for our patients that test positive with COVID, you may get a call from the Red Cross or a local blood bank organization requesting that you donate your plasma. We are using the plasma from patients who have recovered from COVID to help treat patients who are currently infected with COVID. Your plasma holds antibodies. And the thought is, if we can give them some type of natural immune response, there'll be a way to arrest the virus, to treat what's going on with them. There is also a medicine we're using called remdesivir. That's the antiviral I talked about that stops the mutation of the virus. So it's a good drug, but you have to qualify for it. We've got to check your liver enzymes. So some people, because of their condition, don't qualify for remdesivir and will look at other modalities like antibodies. And you can have some side effects from it, just like with anything. You know, the body aches, we expect that with COVID, loss of sense of smell and taste. And sometimes that can linger for a couple months. How long should you wait to get the vaccine if you already had COVID? So 90 days. They recommend 90 days from when you tested positive. Has there been a successful trial using RNA? So the phase 3 clinical trials that went into play with Pfizer and Moderna and a couple other companies have been successful, and that's why this virus is using mRNA. Specifically RNA, that's really not my field, but I can look into that. If you have a specific question, if there's a specific virus you're looking for to see if they're using RNA in the treatment of that, I can better answer your question, because RNAs and mRNA therapy are used for a lot of different viruses. There's so many out here. So good question, but need a little more specific information. I think somebody was saying 90 days. My father has COVID, but my mother tested negative. Why wouldn't she have contracted it as well? That's a good question. And we see that a lot. Oftentimes we see in communities or home settings that either everyone tests negative or just one person and not the other. And that's just the nature of the virus. We don't know why. We can't say that, mom has a better immune system, but I'll contribute to mom has a better immune system, or the exposure to the person with the virus. So you can spread the virus 48 hours before you even show signs or symptoms. So if you're exposed on a particular day, that day that you're exposed, you're not likely to spread it to someone else. It's 48 hours after you've actually started to develop the virus. 48 hours before you start to show symptoms. But sometimes that's just how, the pendulum swings. One person gets it, the other does not. But more often than not, if one person in the home tests positive, any other persons in the home usually will. Question is a burning feeling of fever was normal over a common symptom after getting vaccinated. So the sensation of like burning, tingling all over. I haven't heard that, but some people experience chills. Some people can experience fever. And for some odd reason, I've had patients who, we check their axillary temperature, so under their arm, or the way we're checking temperatures now is we do it cutaneously. And that temperature may read normal, but when we actually truly want to get a core temperature, like in the ICU, we stick a temperature probe into someone's throat that's intubated. That really gives us a good reading of their temperature. But I haven't seen that particular side effect. It could be a side effect. And with people using the VSafe app, it's something that we can collect more data on. Does taking zinc or elderberry every day help keep you from catching COVID? So I will say no. It is good for health in general. I'm a big holistic provider. I'm one that swears by apple cider vinegar, especially for my patients with certain illnesses, but it will not prevent you from catching COVID. The one thing that'll prevent you from catching COVID is really avoiding coming in contact with it. But zinc and elderberry have some other effects within the body. They're antioxidants, anti-inflammatories. Let's see. Are there any reports of the vaccine making someone with autoimmune illness worse? I have not seen any reports of that where it makes an autoimmune illness worse. But I will say for patients who have autoimmune illnesses, they're considered high risk. So those are the patients that we're really suggesting get vaccinated. But if you have an autoimmune illness and you've had a reaction to an injectable medication, so say you're going and getting biologics or immunosuppressants and you've had a reaction to one of them, you really should discuss getting the COVID vaccination with your immunologist before you get it. They'll be the ones to guide you the best based on whatever your reaction was to the previous injection. What other viruses are mRNA and RNA used to treat? So there's a host of them. We've got viruses that affect the gut. We've got viruses like chicken pox or herpes or shingles. They're all the same class of viruses. So they're using this type of technology to investigate and treat. With viruses, it's important to know you cannot cure a virus. They just have to run their course. So a lot of people get sick. They come to the office. I need an antibiotic. An antibiotic won't cure a virus. Viruses have to run their course. Now, we do see comorbid infections associated with viruses. Like with COVID, we're seeing patients who have COVID pneumonia, but they've also developed a bacterial infection in addition to that. So we'll treat with an antibiotic. And we can really tell the difference by looking at how your CAT scan or your X-ray presents. But mRNA and RNA are used to treat a lot of different viruses. We've got like Coxsackie viruses. We talked about the chickenpox, shingles type of viruses. When children are first born, like hepatitis B, they get a vaccination for that. That's not necessarily mRNA, mRNA technology, but it's been around for a while. But in general, there are a lot of viruses where they're using this because we're essentially trying to find a way to decode the virus makeup. And all viruses have they're double-stranded, triple-stranded. So they all have strands of RNA that we try to decode. We have DNA as humans, so that'd be the difference there. Also, can you discuss the need for testing for other problems if someone tests negative for COVID but are still displaying symptoms? Yes. So one of the biggest things that I see come into the emergency room is someone who's having shortness of breath. Right now, we're in COVID mode. It's COVID until proven otherwise. And emergency room physicians have become very good at doing this protocol called diagnosis or differential diagnosis. If it's not COVID, is it the flu? If it's not the flu, is it a blood clot in the lungs? If it's not a blood clot in the lungs, is it cancer or is it inflammation? So there are a lot of other things that someone should be tested for if they test negative for COVID. I'll say, if a person tests negative for COVID and I do imaging and their x-ray looks like it's COVID, I'm going to isolate it and treat it like it's COVID until it's proven otherwise. And there's a very unique way that COVID will display on a chest x-ray. It's very patchy. Sometimes you can get what we call a ground glass effect. So COVID until proven otherwise, but there are a host of other things. Children's Hospital actually had something on the news. Children are presenting with widespread inflammatory skin presentations with COVID. And some of these can be pretty serious. And if they test negative for that, then we've got to figure out why they're having this inflammatory response. So there are a lot of things that we have to test for. And I think those were all of the questions in the chat box.
So, Dr. Sherman, give us, um, describe to us what a day looks like at work, that type of environment, because we still have some people out here that's still not taking this serious, and some I guess for whatever reason feel like they can't get it. But if you could just describe what it looks like a day in your shoes at your job.
Absolutely. I'm going to answer Mr. Jeffcoat's question real quick. After receiving the vaccination, can you discuss whether social distancing, masks, and hand washing should continue? Absolutely. Because until we have achieved a certain level of immunity for a certain percentage of our population, the potential for COVID to spread is still there. So yes, absolutely, you should continue those safe practices until we see that our COVID numbers are dipping down. And that majority of the population has either developed immunity or has been vaccinated. But good question. So I'll tell you what a day in my shoes looks like, and boy, are my days long. So I usually start the beginning of my day with my full-time job, which is with Chesapeake Supportive Care and Hospice of the Chesapeake. It's one of the biggest hospice organizations on the East Coast, Joint Commission, Gold Seal, all things hospice and palliative care. It's a really good organization. So I typically start my day with going out into the community and seeing patients. I see patients who are not admitted to hospice. I see patients who are admitted to hospice. I see COVID patients and I see non-COVID patients. But these are patients who are really struggling with chronic illnesses. So for me, one of the first things I do when I wake up, I check my temperature. I have to do an extensive symptom check, make sure I'm not having anything that looks suspicious. And I have to log that, and then I get what's called the green light to go. Based on my responses, I'll get a message on my app that says you're cleared to go out into the field. Then I have to put on all my PPE, which consists of headgear, an N95, a mask over top of the N95, a face shield, and when I go into homes, that's a gown, gloves, shoe covers, and hair covers most times. I go from home to home. In between going to homes, I have to sanitize everything. So I keep hospital grade wipes in my car. I have to wipe down everything. I probably use hand sanitizer 200 times a day. When I touch my pen, anything that I do. I spend a lot of time answering questions and calming fears, especially for my patients who are very ill, because they know if they contract COVID, it could be, and most likely will be the end of their life. And of recently, I've been giving information about how people can get vaccinated in the community, which I'm really excited about. So I move on from seeing palliative and hospice patients and, putting in death certificates and writing prescriptions to then moving over to the hospital. So a couple days a week, I cover Laurel Regional Medical Center, which is a COVID only hospital. You can only be admitted to that hospital if you are COVID positive. I spend a lot of time in the ICU there. Most times I'm talking with families who we know that their loved one is not going to survive. So we put a plan in place to make them comfortable, to liberate them from the vent. And when I mean liberate, to take them off of the breathing machine, knowing that they're going to pass. So there are days when I may be at the bedside of three or four patients, and I'm holding their hand as they pass away, or I'm FaceTiming my husband and other ministers to pray over these patients and pray for their families because we know that they're making their transition. I spend a lot of time making sure my patients are comfortable and not anxious, and they're not suffering from anything disturbing as a result of COVID or any other critical illness. So if I'm not covering at Laurel and helping with discharge planning, are we going to send this patient home? I'm celebrating with patients who have survived. My oldest patient to survive was 102. And that was a celebration to see her leave out of the hospital because we truly did not think that she would survive. So, we go from walking people into death, which for some people, especially Christians, the families come to the realization that they're not just leaving and, they're sitting to this place where nothing happens. They do feel relieved that they're passing on and going to be with God. But then we also celebrate the victories. If I'm at PG Hospital, so Prince George's Hospital Center, it's the same thing. They do have a COVID tent there, which is an outside building. I see patients there. I have a lot of equipment I have to put on to go into those units. Um, and I got to do a lot to take it off, sanitizing, gowns, boots, everything. And then I go and see my patients on the floor who again are in fear because they know that COVID is in the hospital. So they're, afraid. And one of the biggest hurdles I have to overcome is because of COVID, family members can't come to the hospital. So here I have a family member or patient and their daughter who hasn't seen them in 3 months because they may have come in from a nursing home. So we find ways to connect them, whether I'm using my phone to have a FaceTime or I'm setting up Zoom or I'm just calling people to give updates. I saw your mom today. She was doing great. Or she wasn't doing so great. And I do a lot of communicating with other physicians because talking about death and dying, that's my specialty in palliative care because we know at some point or another, everyone is going to have to leave this earth. And a lot of physicians and other providers are not comfortable talking about death and dying. So I spend a lot of time speaking with providers to really help them overcome that discomfort with having that conversation and delivering that bad news to families. And then I come home and I've got my husband and my two children who are usually either asleep or full of questions. But that is essentially my day, or I'm educating the community like I'm doing now, where I'm doing a lot of community education. I think you're muted. And then somebody asked a question here. After running errands, I sanitize my purchases, launder my clothes, and take a shower. Is this still a good practice? Um, I would say, yeah. I mean, if that makes you comfortable, certainly. Um, sanitizing your purchases may or may not be required. Like if they're food items, you can wash them off. Cleaning your counters and high touch areas with a typical anti-dis or disinfectant is decent. And, washing your hands, changing your clothes is always a good practice.
Dr. Sherman, the reason why I asked you to give us a picture of what it looks like in your day and what it's like for a person like you to walk in your shoes is because of the fact that we appreciate you. And there are many people on tonight from many different places, a lot of different cities, and they're on tonight. And I brought you on tonight because um, I believe in what you're doing. And I know you are one who studies and you have put in the work. And that's why the Lord has blessed you. And to all of those who are listening and watching tonight, you've heard how long Dr. Sherman days are. And then she takes the time out to work in her community and do a platform of what you see and hear tonight. And then she probably doesn't have much time left for her family. So here's what I want you to do. I want you to be a blessing to her. If you could put your Cash App in there one more time. I don't care what the amount is, whatever the Lord lays on your heart. We want to show you how much we believe in you and that we are behind you 100%. We're praying for you on a daily basis. I thank God for allowing our relationship to take place. And you have done a great job tonight. You have, I think, expelled a lot of myths that has been out. Some of these conspiracy theories. And as Black people, we want to make sure that we're not being duped like we have been down through the past. And so that's why I asked you to come on, because I know where your heart is. And I know you're a straight shooter, and you're going to um, tell us the truth. And so I definitely appreciate what you're doing. I thank you for coming on tonight and answering these questions. I think you have put my mind at ease about some things that I was struggling with, and I appreciate that. And I pray you have done so with others who have asked our questions and who have tuned in and may not have said anything, but just listen. So um, it is my job as a bishop is to um, make the community, um, give the community, let them know that there is information available. This platform, the Lord have given it to us, and we want to use it for His glory. And so the Bible says our people perish because of lack of knowledge. Mm-hmm. And so it is my idea that as more knowledge we can get, the stronger we can become. And then we're not held hostage to the enemy's lies. So again, thank you. I think, let's see, seen comments on social media from medical professionals stating that the vaccine will alter DNA. Can you, let's see, I'm gonna get them to put this in the chat box.
Okay, and I think I heard a little bit about it, potentially altering DNA. So I have not seen any credible sources stating that. So we have to remember, this is RNA. So RNA is essentially the DNA for viruses. We have DNA. So no, I have not seen any credible sources saying that taking this vaccination is going to alter your DNA. And I don't think that would be something that would be ethical or something that would have not have come up in a phase 3 clinical trial. That's a significant trial. And I know that it seems like we did this rather quickly. I want people to know that some of the bravest people who signed up to go through these clinical trials were people that I stand shoulder to shoulder with every day. They were medical providers. So not only are we running into the face of danger every day, we're stepping up to say we believe in this, and we're going to actually contribute to the development of this. So it's really important to know that, because as a medical provider, I would never want to recommend something to my patient that I didn't believe in myself, or I didn't believe would be doing the good for the greater population, especially when I have to treat, and my colleagues, we have to treat this every day. It's devastating what we're seeing. A lot of people, in nursing and in medicine, we laugh and we joke, but I'm willing to bet that medical providers have a significant level of PTSD, because some of the things that we have seen as a result of COVID have almost been warlike. They have been devastating. To leave a shift and to know 5 or 6 of my patients passed away, or now I have to call 5 and 6 families to tell them, I'm sorry, your loved one did not make it. That is devastating. To watch your patients die through a glass window and not be able to hold their hand and reassure them, this is devastating to the medical community. But we continue to go out every day, and we do it because that is what we're supposed to do. We have to honor our patients. And we're willing to face that danger. So the most responsible thing that we can do is to educate ourselves. And the vaccination is not for everybody. Some people may say, I'm just not willing to take the vaccination. And that's okay. As long as you made that decision with good, credible information, that's what matters, that your heart was in the right place. If you're making that decision because cousin Joe down the street told you you were going to grow an 11th toe, it's a little questionable. But we owe it to ourselves, we owe it to our families to do what's best so that we can soon come back together and embrace each other. I can't even hug my patients. I can't shake their hands. I know that my family looks at me like I come to a family event and they're like, they don't even want to be near me. I got to go get COVID tested just to go to Christmas Eve dinner. because of what I do. But we have to be responsible. We've got to do this, and the only way we're going to get through this together is to be responsible, and stick with it until we have clear and convincing evidence that we can come out of this quarantine.
Excellent. That's two more questions in. One is, um, should we wear a double mask? And then you can see the other question in the chat box.
Yes. So I wear the type of masks that I wear are triple lined. So even my surgical mask, and I don't have one in here, but even my surgical masks are triple lined. So if you're just wearing something as thin as tissue paper, which some of these masks are, because we had gotten to a point where all we could do was get what we had available, I wouldn't recommend that. I do recommend something thicker. So if you're wearing a 1-layer mask or even 2-layer mask, I would recommend that you invest in better masks. We do have some nice cloth masks that you can insert filters into. Another important thing is to wash your mask. If you're wearing cloth masks, and the CDC has actually been recommending from the very beginning that they should be double layered when they were giving out instructions on how to make masks. But you have to wash those cloth masks because you're breathing in it, then you got contaminants on that outside. So make sure you're washing your mask. And I would say, yes, if you have single layer mask or even double layer mask, so just 2 layers, you want to get something that's quality, and you want to make sure you're disposing disposable masks and not continuously reusing them. We now have a good amount of PPE. Whereas before we were running into a huge shortage, we do have a good amount of PPE. So, take advantage of that and get what you need. Don't stock up so that your neighbor doesn't have some, but definitely get what you need. Same thing with toilet paper. I'm guilty of it, but save some for your neighbor. Let's see. There was another question.
This is a big one.
Okay.
They want to know, do you recommend African American people to get the shot?
I do. And I'll tell you why. African Americans are dying at disproportionate rates from COVID. We have one of the highest death rates any other race in this country from COVID. One, it's because we tend to be less healthy. The rate or the prevalence of hypertension and diabetes in African Americans is higher than any other race, despite African Americans making up a lesser percentage of the American population. With the African American community, I get it. I wholeheartedly get it. I have a book that I've read front to back twice on some of the mismanagement and poor management of medical health for African Americans in this country. What we cannot do is allow that history to keep us in the rear. We have to educate ourselves. We cannot afford to get left behind. I believe that this vaccination was done in a dignified and ethical manner. So I absolutely do recommend it. But I also recommend it that this is a decision that you make based on good information. So again, do your due diligence. Talk with your provider. If you don't trust your medical provider, find a new one, because it's important that you have a trusting relationship with whoever is going to treat you medically. But I absolutely do recommend it just because of the death rate among African Americans.
Okay, there's a couple of more questions in the box, and then we'll shut it down for the night.
Okay.
So you can spend some time with your family.
Got it. So the question is, do you have a reference study on the effectiveness of masks? So there are a lot of studies. You can look at studies from the CDC. You can look at studies from a lot of these academic institutions that we mentioned, I think a little further up in the chat. So places like Hopkins, Yale, Harvard, because a lot of people contribute to science, and I wouldn't just trust one source. You're gonna want to go to a lot of credible sources who are looking at the effectiveness of masks. I know at one point they were doing like cough and sneeze trials where they were using ultraviolet light. They would have an individual cough or sneeze, and then they would measure how far droplets would make it with a mask, without a mask. They would look for any bacterial growth. They do this with people who test positive for flu, where they'll have that person cough or sneeze with a mask on, and then we measure how far those droplets make it, and that's how we know how to isolate and what things are going on and who has the greatest potential to contract it. So there are a lot of resources, Mike. And then I can get with you or get some information to you about some of the references or resources that I've received. As a medical provider, I'm on an app called Doximity, and then I get a lot of medical journals. So I get stuff daily, a lot of stuff, sometimes too much, that I'm constantly reading and updating myself on.
If you can back up to one, I think it was read today about this variant from South Africa. You see it? Okay.
I did see, I saw it a little ways up, but yes. Read today about a variant from South Africa that was discovered here in South Carolina. I saw that was reported, I think, by ABC about 7 hours ago. I got a big notification about that. So yes, I talked about that. It is not uncommon. It's usual nature for viruses to mutate. So this is not surprising to the medical community. Again, to a person who's not in the medical community, who doesn't know that all viruses tend to mutate in some form or another, that's how they survive. It sounds devastating. Oh, there's a new strand. But in medicine, we know this. This is the typical common course of a virus. And what we know is that these new variants of the virus could potentially be more contagious, but are no more deadly. So they're easier to spread. They believe, research is suggesting there's significant evidence to say that the vaccinations we currently have will protect us against these new variants. And that's not, written in concrete, but the best evidence shows that that's the case. So yes, we know that there are going to be new variants. It happens all the time. Just with like HIV, they're different strains of HIV. They're different strains of the flu, for instance. Every year we develop the flu vaccination based on the best clinical knowledge we have to know which strain we're gonna be dealing with. So if you ever notice the flu shot, we have the quad or the tri. So that means that it has three samples of the tri has three samples of flu viruses or flu strains, or the quad has 4 types of flu strains. And based on which one you get, the thought process is that you'll have protection against those particular strains. Now, sometimes they miss the mark, but for people who have gotten the flu shot, even if the virus or the type of flu they come in contact with is a different strain, the fact that they've had a vaccination, they're less likely to be as sick. So we know that viruses mutate. It's expected. Just the media gets a hold of it and makes a big to-do out of it. And in medicine, we try to give good information, but sometimes the media will do things for a story and mislead people. So I don't want you to be worried that there's this variant in now in South Carolina, because we expect it. And we expect to hear a little bit more about it.
Got 2 more in the chat box, and we'll cut it off after that.
All right. How long can a person expect COVID symptoms such as fatigue to last after diagnosis and no longer testing positive? What do you suggest a person do to help the fatigue? So this can vary. People in their recovery from COVID can take weeks to months. I have patients who are now 6 and 7 months out. There is now a new protocol that we're researching called post-COVID syndrome. And it's a triad. So you have a couple of different of the side effects that remain after testing positive and recovering. One being loss of sense of taste and smell. That can linger for a while. I've been seeing some holistic remedies. I have a couple friends that grew up in Jamaica, and they were telling me about I guess cooking down an orange, and some people say it works. I've never tried it because I've never tested positive. But it can vary. It's going to be highly individualized. If you are still significantly fatigued after having COVID, I recommend that you talk with your medical provider. I am ordering physical therapy so much for my patients who are recovering from COVID, because this virus completely wipes you out, especially for my older patients. If we were to lay in bed for 1 or 2 days, we're going to be a little weak when we get up. Imagine being in bed for 20, 30 days. you have to learn how to walk all over again. So I'm not surprised that people would be fatigued. You want to get a good exercise regimen, simple things like you can sit on the edge of your bed or sit on a chair and just kick. If you're watching TV, every time a commercial comes on, kick out with both your legs to get to start building that strength. Go for a walk. If you're unsteady, you need a cane or an assistive device, or walk with someone on the treadmill, resistance bands, anything you can do to build your strength back up, but don't push yourself too far. And then the second question is, will the vaccine have an effect on this new variant of the virus? Yes, the latest research shows that the current vaccinations that we have will give you a very broad immune response. So this isn't a narrow immune response. This type of technology is gearing the body up to give a broad immune response if you come into contact with COVID. These are still coronaviruses. So the thought process is, yes, you will have protection against these new variants. We're still collecting more information every day. So it's something that's kind of stay tuned about. I always tell people in medicine, one of the worst things or that I can go through as a medical provider is to tell my patient I don't know, but it's one of the most honest things that I can do. And with COVID, there's a lot that we don't know. Medical providers, sometimes it puts a little dent in our pride to say that we don't know, because we know a lot. But when it comes to COVID, there's so much that we don't know. So don't be surprised and don't be offended if your provider says they don't know. It's just that we're still collecting information, and then we have to disseminate it. We've got to collect the information, synthesize it, and send it out so everyone has a good understanding. So, a lot's to be determined here.
Well, Dr. Sherman has flat-footed for an hour and 15 minutes, answered all of our questions in a very professional way, and we want to applaud her. Please, in the chat box, give her a thanksgiving shout out to her for her time that she has taken to help us to come to some type of decision concerning this vaccine. I think it was very helpful tonight, and I just want all of the people to know that when you see Let's Talk About It come on, I'm not bringing junk on here. I'm bringing the best out there. And so we thank you again, Dr. Sherman, for clearing up a lot of the fairy tales and conspiracy theories and all of the stuff that we've been hearing. Again, I say I trust you. That's why I brought you on the platform tonight, because I know how diligent you are and what you do. And so we appreciate you so much. And if some new stuff come out where we need to do this again, you will be seeing Dr. Sherman face again when we can get her, because we know she is busy. She is. Last night I watched her live on Facebook walk out of the hospital at 11 o'clock. And I'm like, wow. So again, we appreciate you so much. And those of you in your prayer time, please call out her name, her colleagues, and her family. They're on the front line. They're seeing things every single day that sometimes you can't, it's not easy to wipe out of your mind. So we want to make sure that we lift her up in every way possible. So again, if you have any closing remarks.
No, I just want to thank you for giving me the opportunity. One of the things that I just am so passionate about is bringing good information to the community, especially in the minority community, when there's a lot of misinformation and there's a lot of mistrust. Mistrust is a big barrier to care, and it's time that we start moving in a positive direction. I'm a big advocate for more minorities and women in medicine, because we really need that. We need to see people who reflect what we look like in medicine, so that we know that there are people who have a seat at the table, who have our best interests at heart, and who understand what we go through as a people. And that's for any culture, not just the Black culture, it's for any culture. But, I just really am excited about organizations and churches like New Life that are willing to put this platform out there and really pride themselves on keeping their congregation engaged and informed. So thank you for giving me the opportunity.
Amen. Thank you. So we want to say good night to all of you, and we will be posting this on Facebook. T, if you could, not just Facebook, but YouTube. T, put all of the places where you can find this video, because we have recorded it. So if someone that in your family didn't get a chance to see it, or you started out on here and didn't get a chance to finish, you can come back and you can look at this again, and you can share it with as many people as possible. So we want everybody to be informed. So when you have to make your decision, you know which way you're gonna go. All right, good night, everyone. Thank you so much for tuning in to Let's Talk About It. God bless you, and we will let you know the next time we'll be coming on with our next new topic. God bless, and everyone have a good night.
Thank you.
Bye-bye.